My journey really starts as being an advocate at a young age, translating in healthcare settings that were not culturally responsive or able to meet the needs of my family.
I started my career in public health interning, having to break the mold as a person of color and as a young person wasn't always well received. Having to fight those barriers, something that I always encountered. Even now, being in my current role, it's always something that's constantly fighting that I belong here.
I started my journey in public health as a frontline worker, not knowing at the time that I was the gateway between communities and the programs and systems that were created by public health professionals that I had never met.
These systems are supposed to be helping marginalized communities, yet they actually hurt a lot of the folks that they're trying to help. You often go around these systems, or you figure out who your allies and champions are, who will be part of the change that needs to happen with these systems that are failing our people.
As I've navigated to higher positions, it becomes whiter and whiter and whiter, and there's less brown people. In executive positions, there's less black and brown faces at the table. I've found myself on numerous occasions being the only Latino male in the room, and it's very jarring for me to go from one locale to another and to have to speak for an entire community.
In public health, it hasn't always been the best. Sometimes other divisions may not understand your culture or may not understand exactly what's needed for the particular population. I work with targeted populations, so men who have sex with men and transgender individuals. There's definitely some education that needs to be had, so I'm able to provide that education, provide them with something that they didn't know before, and they're listening because they're really not getting it from anyone else.